You're welcome again. What causes water retention and how can we deal with it? If you have noticed part of your body suddenly becomes swollen and puffy, it is probably not weight gain, but water retention. This is a common condition that in the medical parlance we call edema or edema, which causes swelling when excess fluid builds up in your tissues. Edema can happen to anyone, but those most at risk include people who are pregnant and older adults. Luckily, treatment can be as simple as lifestyle changes or making changes to your medications. Then let's talk about what is water retention. Water retention, also known as edema or fluid retention, is a swelling caused by fluid buildup. This swelling then causes the part of the body to become bigger and puffy due to excess water in that particular area. This can happen anywhere in the body. Swelliness in the legs is very common. For example, as is water retention in your face. The body has a very complex system to control fluid levels. But the kidneys are the main organ in control of water retention. Their job is to filter blood and maintain fluid levels in the body. So let's go into some of the causes of water retention. The most common cause of water retention include the following: sitting in one position for too long, eating too much salt, pregnancy, hormonal changes, certain medications like taking diuretics to manage high blood pressure. There are certain underlying conditions that can cause water retention too, including heart failure, when the heart can no longer efficiently pump blood. Swelling in the lower extremities, that is your legs, the ankles, and the feet. Eventually, fluid buildup will occur in the lungs as well. Then what about kidney disease? Kidneys are responsible for filtering blood and controlling fluid levels. So if the kidney is compromised, edema occurs. Poor circulation issues with circulation can result in water retention and swelling due to fluid buildup. Let's talk about the symptoms of water retention. Water retention can make you feel heavier and puffier than normal. The most common symptoms are swelling in the feet, the legs, the hand, or occasionally the abdomen. You understand? And when we're talking about this swelling causes pitting or indentation. When you press, it remains. The hold you are making with your hand remains in the leg when pushed down or compressed, like with socks. Other symptoms of fluid retention can include the following. Number one can be soreness, can be fatigue, shortness of breath if fluid builds up in the lungs. Remedies for water retention. In some cases, water retention can go away on its own. But if you are actively trying to reduce it, there are some natural remedies for fluid buildup that can help. Number one, drinking more water. Cutting back on salty and sugary foods. Exercising, elevating your feet. Wearing compression socks. If the swelling is in your leg, you can also try gentle exercises for swollen feet and ankles. Other ways to help improve swelling may include talking with your physician about medications that improve the kidney's ability to get rid of extra fluid. What are the tips to prevent water retention? In some cases, water retention is preventable. With proper lifestyle, dietary changes, it is possible to avoid it altogether. So let's dive into some tips that can prevent. Number one, you have to stay hydrated. Good evidence. The easiest way to prevent water retention is through maintaining proper hydration. You drink water. When we are slightly dehydrated, the body holds on to any extra water. To combat that, aim to drink 60 to 80 ounces of water a day unless on fluid restriction by your doctor. Number two, exercise. Another strategy to keep swelling in check is to exercise regularly. Exercise, utilize your muscles to push the water out of your tissue and back into the vein where it belongs. Limit your salt and sugar intake. While you don't have to completely write off salt and sugar, limiting this to These two ingredients can help reduce the amount of your water your body holds on to. What are the foods that can cause water retention? Number one, smoked or canned meat. And fish, deli meat, bread, canned soups and vegetable, pizzas, prepackaged frozen meals, baked goods, salty snacks like chips and pretzels. This food can cause fluid retention and inflammation in the body. And of course, number four, try supplement. There is a little research to suggest certain supplement and medicinal herbs can help reduce swelling, but you should always talk to your doctor before trying anything new in this area. So, some of the supplements suggested that may be able to help reduce swelling include dandelion roots, magnesium, and vitamin B vitamins, all of which can play a role in managing the amount of fluid in our body. So, when do you need to see your doctor, my dear? If your swelling does not improve after a few days, or you are after trying the above remedies and prevention strategies, you should seek medical care to establish the cause and finding ways to get your swelling under control. Remember, it is possible you may have any underlying condition causing the swelling, which your doctor will be able to diagnose and, of course, treat. Remember, health is wealth. See you in the next video.